right, let's bring in WHO advisor Mary-Louise McLaws. Great to have you on the program again. What are you hoping to come out of this meeting in practical terms? What can we expect?
Look, I think there are several issues, and one of them is to explain to the public the difference between WHO's perceived power and WHO's real power, and a misunderstanding of how WHO can control other countries' responses to the virus. And perhaps this meeting and the call for a review is an opportunity for the 194 member countries to be reminded of their legal responsibility that when a public health emergency of international concern is called, not when a pandemic is called, that is when they are legally obliged to start preparing and getting ready in case the pandemic comes to their shores. Now, WHO has no real power to ensure they do this, but this is a great opportunity to remind them that they have an obligation for all of humanity.
We've seen varying responses from different countries to the pandemic, some in direct contradiction to recommendations from the WHO. How important is it for these countries to address their differences? And is it even important for them to be on the same page because every country is different?
Look, WHO is supposed to be there to help coordinate outbreaks. And of course, WHO will, when it's invited, go into countries to assist, to give technical advice and assistance. However, only goes into countries when it's invited. So countries that are high resource countries that feel that they can look after their own epidemic. Some of them haven't been doing as well as they should be. Some of them aren't testing. Some of them aren't doing some basic infection control. So this is a good opportunity for each country to reevaluate how they've gone. Because if the Northern Hemisphere doesn't contain this, it will come to the Southern Hemisphere. If the Southern Hemisphere doesn't contain it during their winter, they will bat it back to the Northern Hemisphere. And this will go on for years until we get a vaccine. So it's a very timely opportunity for each country to talk about how well or not their responses have been. And every country has made errors or been slow.
Mary-Louise, the WHO's assemblies usually tackle a number of health issues, but this time it is just COVID-19. How much of a distraction is this virus from other health concerns facing the global population?
This health assembly will only be for 2 days via the internet. It normally is for 7 days, and it normally has a long time to talk about all of the other chronic and acute diseases that countries other than high resource countries have to cope with. But these will get an airing during the health assembly, but there will be a tendency for COVID to take most of the oxygen from this meeting if, of course, the members aren't careful.
Another big point of discussion, I know, is the U.S. President Donald Trump's decision to withdraw U.S. funding, or at least drastically reduce funding from the WHO. How much of an impact has that had?
Yeah. Look, it's not so much of a financial impact because the US does provide a lot. It's up to about 15%. Of course, Bill and Melinda Gates provide a very large proportion, the UK and Germany. And of course, there are many other philanthropy gestures that help support, and of course all the other member states have to support as well. It has more of a distraction when one of the biggest donors starts talking about withdrawing. It doesn't signal solidarity, but WHO will survive.
All right, we'll leave it there. WHO advisor Mary-Louise McLaws, thank you again.